about their jurisdiction and what they're doing. And then after that, we really want to leave plenty of time to make your questions. And those questions are going to be taken through the question and answer button on the bottom of your screen. And we appreciate you using that. Of course, you've all heard of Zoom bombing, so we'd love to let you just all in and ask those questions, but we are using the question and answer button. And I'm excited to have all of our panelists here with us today. We have County Commissioners Emma Pinter and Eva Henry. Thank you for joining us. We have State Representative and Dr. Yadira Caraveo with us. We have Mayor Pro Tems Anita Seitz and Jenny Wilford. Anita from Westminster, Jenny from North Glen. We have City Councilor Julia Marvin from Thornton City Council. And we have School Board Member Kathy Plomer from Adams 12. And so we are very excited to have you all with us. We all proudly represent Adams County, and it's not a coincidence that we are all women, and we wanted to highlight that today, that really in this time of COVID, we've seen a lot of articles about women internationally and women nationally stepping up to lead in our response. And we wanted to highlight that in Adams County, you have a great amount of women leaders that are stepping up in order to respond to the coronavirus. And here are 8 of your best from Adams County, and we're excited to be here with you. I'm going to go ahead and get started. I'm Senator Faith Winter, and we all thought we would start a little bit and talk about how we are also 8 weeks into quarantine, right? And we know that this is really hard, and we wanted to talk a little bit about what that looks like in our daily lives as well as we give our updates. So I am 8 weeks into quarantine. I have 2 amazing kiddos that I am helping with remote learning. They are 11 and 9, and basically we have figured out that I cannot do any work between 8 and 11. That is their time for remote learning. And I have not been doing my state senator work between 8 and 11. So if you call me between 8 and 11, I'm not going to answer your calls because I'm working with my kiddos on doing remote learning. And you know, we've had a lot of questions that I'll leave to Kathy Plomer about remote learning and how Adams 12 is dealing with it. But I really think we should all thank the kids as well, because their worlds have completely turned upside down. They're not seeing their friends at school. They're not connecting with their teachers nearly as much. Remote learning really, because it's asynchronous, which makes sense, is almost like a lot of homework that you have to walk yourself through and maybe email a teacher once in a while. And getting them through that has been interesting. I also have been cooking a lot, which is fantastic. And I learned how to make bagels. I am a horrible baker, and I took an online baking show and learned to make bagels. And the rest of my time I'm spending on Zoom meetings like this, figuring out what we're going to do when we go back in session and taking constituent calls. And so I want to let all the constituents online know that we are here for you and we're listening to you. I've walked numerous constituents through getting unemployment. We know that right now there's a lot of problems if you have a W-2 job and a 1099 job, and getting your unemployment for both those is pretty much impossible. Those are federal rules. We've been working with our federal delegation in order to try and clear that up. I've been working with a lot of constituents about addressing remote learning situations, working with constituents about accessing healthcare. We did extend the time period to sign on for healthcare, which is really important. We're also working with HCPF to make sure that Medicare and Medicaid. We are also working really hard to address supply chain issues at the state level. And so early on, we didn't have enough PPE, which is what we need to protect our doctors and nurses as they're serving you. And that was the first problem we worked on. And so we worked with outdoor manufacturers that eventually started making PPE. We've worked with distilleries that started making hand sanitizer to shift over those supply chains. The next big issue we're working on at the state level is to increase testing. And you've started to see testing open up throughout the state, testing open up through private services. And today is the official day that in Adams County, we are moving from a stay-at-home order to safer-at-home order, which means that it is really important that you understand it is safer to stay at home. This is not opening everything up. And really, if we all were responsible, washed our hands, wore masks, stayed 6 feet away, we could open up a lot more. So I'm asking everyone on this call, as we move from stay at home to safer at home, to take those pieces of information and stay safe. The other thing, unfortunately, that I've been working with a lot of constituents on is there has been an increase of domestic violence and violence against children, because we are all in very close quarters, and relationships that might have used to work when you weren't in the same home 24/7 have started to break down. And we want to let you know that regardless if it's stay at home or safer at home, those resources to addressing domestic violence are there for you. There is a mental health helpline, there is a domestic violence hotline. We can share those with you. But that if you are in a home experiencing those issues, to please reach out, because stay at home does not mean stay at home with an abuser. And I think it's really important that that those services are still out there. And then the last update I wanted to quickly give, that's not related to the coronavirus, but related to an issue that I've worked on for a long time, is with regards to Title IX on college campuses. Title IX ensures equal access to education for everyone, including women. And a lot of people think Title IX is just about sports, but it is actually about preventing rape and sexual assault on campus. Right now, 1 out of 5 women that go to college experience some sort of sexual violence. And one of them is going to drop out of college because they don't want to experience more sexual violence. And that means they don't have the same access to education. And unfortunately, the federal administration this week decreased the protections for women on college campus. I worked on a law last year that codified protections on college campuses, and now I'm working with Attorney General Phil Weiser to ensure that we keep those protections, and we are suing the federal government to make sure that women in Colorado going to college are protected. And so that's a little sneak peek into the Senate. We are also deciding what to do when we go back. The things that we are going to work on is making sure you have access to unemployment, making work share programs work for unemployment, work on housing access, and then trying to pass a state budget that doesn't reduce funding for everything we care about. And that's what we're working on. And with that, I'm going to hand it over to Representative Caraveo to give her update.
Thank you, Senator Winter, and thank you to all of the incredible elected officials, female elected officials on the Zoom today. Adams County has a history of being very united amongst its elected officials, and I am so happy to be able to work with these women to advocate for all of our constituents in Adams County every day. As was mentioned earlier, I'm also a doctor. I'm a pediatrician, and I'm actually the only doctor in the state legislature at this time. And so about 3 days after session adjourned, I went back to clinic, really kind of expecting an onslaught of patients. We knew it even then that kids were doing quite well with coronavirus for reasons that are not completely understood. But thankfully, they're dodging some of the worst complications until recently, when it's become apparent that they are suffering from a kind of an odd syndrome. But really what became apparent immediately was that there are real challenges in the medical community. We've all certainly heard about the lack of PPE, and even now we're using one mask at the most every day. Some of us are using it for a few days just because there is a real lack of supplies, and obviously we want to leave as many supplies as possible to the areas of medicine that are getting hit harder, which are hospitals, in particular ICUs, and the doctors that take care of adults who are having a much harder time with this illness. And so I was very surprised to see that actually our patient numbers really, really slowed down. And so over the first week, it was apparent that we had lost about 40 to 60% of our visits. Parents are understandably very scared to leave the house. We've told people to not to leave the house, and so they're following that advice very closely. And people are afraid of coming to a doctor's office, which is understandable. There's always somebody that's sick in a doctor's office. So we very quickly divided our efforts between two offices. We're lucky enough to have two offices, and we're seeing well children in one office and sick children in another. But we're still seeing a drastic decrease in the number of children that we're seeing for checkups and for immunizations. And it quickly became apparent that all doctors' offices, in terms of family medicine and pediatrics, were seeing this across the state. So I've been spending a lot of time in the last 2 months advocating for those areas of medicine that people don't know are being affected by this crisis. In particular, that primary care physicians, because they are private business owners, are seeing the same stresses that some small business owners are seeing. They're seeing a drop of revenue, and the difference between a private doctor's office and a coffee shop is that we spend thousands and thousands of dollars every month on vaccines, and so that's a cost that we're trying to juggle while taking care of everybody. And so that's what I've been doing kind of outside of the legislature. The rest of the time that I'm not in clinic, I'm spending on Zooms and working on reaching out to constituents. My office was actually one of the first in the state to start making phone calls directly to constituents. We started with those over 65 and then have moved on to do different phone banks for Spanish-speaking constituents, and now those who live in particular areas where they may be really struggling with rent in particular. And so we've called at this point about 4,700 people in my district. My district, by the way, is District 31, which makes up most of Thornton. And we've had almost 1,000 one-on-one conversations. And so that's been really enlightening to see what constituents are bringing up as their struggles, rather than just kind of hearing about it secondhand or assuming about what they may be going through. And then I've been trying to advance some legislative efforts from before this pandemic hit. Along with Senator Winter, I was on the paid family leave bill, which unfortunately did not gain traction despite the issues that we're seeing with that across the state. I think we all would have been in a much better place to deal with illness and to deal with exposure to illness if we didn't have to worry about balancing our jobs and keeping our jobs when we've been exposed or when we're ill. Unfortunately, that didn't gain traction despite this. And so last week we made the difficult choice, the four sponsors, of letting that go in the legislature and endorsing the ballot measures that are being proposed that are hopefully going to be brought directly to you to decide on. I've also been working on a telehealth bill even before this for FQHCs, which are federally qualified health centers. So places, the clinics that really take care of our most vulnerable across the state. They've never been able to bill for telehealth services. They were kind of left out of that in Medicaid. And so we're trying to make sure that although right now those visits are being paid for through emergency orders that the governor put in place, that will continue even when we're not in a state of emergency. And then finally, I've also been continuing to push a multilingual ballot access bill that I've been working on for 2 years now. There's certainly large areas of Thornton and all across Adams County where people have the right to vote, they're citizens, but our ballots are written in very complicated language. And if English isn't your first language, you may not fully understand what the complicated ballot language is talking about. And Colorado doesn't have any requirements really apart from what the federal requirements are for translating those ballots. So I've been continuing to push that. It's going to be really important that we all have access to voting by mail so that democracy is not interrupted because of a pandemic. And so it's going to be just as important for those who don't speak English well to have that right. So those are the few of the things that I've been working on. I'm also doing a lot of yard work now that I have a little bit more time on my hands. And so it's been an interesting 2 months. But with that, I will pass it over to Commissioner Emma Pinter, who is the commission chair, and hear about what's been going on at the county level.
Great, thanks. Representative Caraveo. Just to give you a brief update, I'm joined by my colleague, Commissioner Eva Henry, and so we'll both be giving you some updates on some of our different work in county government. I feel like for many years, the number one question I got was, well, what does your county commissioner do? And if you don't know during the pandemic, let me tell you, we are the ones who run Health and Human Services. We are the ones who have the statutory authority to have a health department. We are the ones who coordinate your local municipalities. We are the ones who coordinate your countywide economic development efforts, as well as the unemployment office. So if you're doing something in the pandemic, you're probably doing it with your county government. So just so that you can be rest assured, your county government in Adams has been working very, very hard, despite being one of the first to close. We've been home for weeks and weeks and months. During that time, we issued hundreds of laptops to our staff so that you can continue to get Health and Human Services services from home. Really excited to announce you can now apply, and not just for SNAP online, but you can get SNAP delivery at your house. That's up and coming in the next few weeks. We have that information on the Adams County website. We have been working really hard with our federal delegation to make sure there is that continuity of service, that if you need one of the services like SNAP or TANF or unemployment, you can get it through your county offices online or over the phone. I work on a response and recovery team, and so does Commissioner Henry, and the two that I do are childcare and unemployment services, and we'll talk about those in a little bit more detail if you have any questions. But with childcare, we've been working with the Early Childhood Partnership of Adams County to make sure that your childcare offices stay open and that they're working in conjunction with the health department so that when they're open, they're safe. And that's been a really Herculean effort. Personally, I'm a parent. I have two kids. My kids are 8 and 12. We use BASE, which means we use aftercare at the school. And so when the school closed, we lost everything. We lost our schooling, and we also lost our childcare. And it's been a little bit of a scramble to put our household back together. Personally, it's been interesting to watch my husband notice how much goes into keeping our kids running. He's been a great partner, but he's like, we could just handle this on our own. And I was like, all right, honey, let's see how this goes. So within a week, he was on Team We Need Help, and I've been really excited to know that we have child care centers that are open in Adams County that are working to stay open and comply with the public health order. And you can find all of that information on the Adams County website. We maintain a special website for COVID. It's adamscountycovid19.org, and I can make sure that one of the staff puts it in the Dropbox. We also have been working really diligently with the health department and all of our hospitals, and everything that Representative Caraveo said is absolutely right. And frankly, what Senator Winter said as well. We have been hearing a lot of concerns from our hospitals on the lack of a steady supply of PPE. We're okay for now, but in chatting with our hospitals just this week, many of them have ICUs that are at or near capacity. And when our hospitals continue to be at or near capacity, it is really incumbent on all of us to make sure that we're doing everything we can to stop the spread of this disease, because we need to make sure that we are wearing our masks when we're out in stores, that we're wearing our masks when we're meeting with other people in any environment, going on a hike with them, that we're socially distant, that all those rules are spelled out on the health department website, but they're not there to confine you. They're there to give you freedom. They're there to make sure that when you go into that grocery store, you can move through that environment safely, or when you're going to work, you can move through that environment safely. And they really are designed to give you as much freedom as possible by following the socially distant rule and wearing your masks. There's a number of homemade ones, how to make one out of a t-shirt, how to make one out of a bandana. There's a lot of videos out there with the Colorado Mask Project is one thing that I really recommend. The last piece that I would really say is that as we're doing this work, we want to be hearing from you all the time. So I'm really grateful to have this opportunity to do this town hall so that we are making sure that you have access to these services. If you're someone who needs unemployment, you should know that you can apply online. But also, if you have trouble with English as your first language, as Representative Caraveo was talking about, our staff will help you fill out the application online. They have special certifications to keep your information confidential, and they will stay on the phone with you. They've said sometimes as much as 2.5, 3 hours to make sure you can fill out that online application. And that is for folks who speak Spanish and another language that we've seen pop up, other languages that we've seen pop up in the community. So if you need services and you qualify for them, please call. We'll help you walk you through those federal programs. And I'll pass it to Commissioner Henry.
Thank you. Basically, they asked us to share a personal story about this COVID-19 in regards to how we're all trying to figure it out and stuff. For me, it was extremely personal because when I was a single mom many years ago, there were times where I'd go to bed hungry, so my children had enough to eat. And I was one paycheck away from being homeless, and at times I'd lose that paycheck, and I have been evicted. So I know what a lot of our families are going through right now. So during this period of time when I know so many of our families, extraordinary number of families that are going through this process of trying to figure out how they're going to get the next meal on the table, or how they're going to be able to keep that roof over their family's head, I have a little bit of PTSD because it is definitely personal to me. Very, very personal that people have to actually go through it. Adams County and my commissioners, I'm so lucky that we have 5 amazing commissioners that all share the same values, who really care about what's going on in this community and are doing the best they can to provide for their community. We have actually started up 7 recovery teams, is what we're calling them. And Commissioner Pinter actually went through the child care the team that we're actually working on. We also have a business support and retention team to help our small businesses and our businesses out there. We have an aging services to help our aging service team to help our older Americans out there. We have an uninsured and healthcare access team that's working out there. A food security and basic essential team that's working, and a support for unemployed and future workforce, which Commissioner Pinter also mentioned out there. I work on the housing stability team, which works on housing. And Adams County has given out over $300,000 in unrestricted funds to the Housing Authority to help with rent or mortgage payments, or even lot payments for those who have mobile home communities. And to qualify, you must have lost your job or have had hours cut through the COVID-19 crisis. You will need you need to actually be a resident of Adams County or one of the municipalities that are in Adams County. The qualifications is 75% of the area median income, which means a family of 4 would have to make less than $75,000 a year. To go for assistance and do the application, you can go to makerhp.org, and Maker is spelled MAIKER, HP for housing partner.org, to apply for assistance. And the application process is going to take 3 business days. What the commissioners also did last week is we approved $800,000 of home funds to go to Maker Housing Partners and Brighton Housing Partners. This fund will serve unincorporated Adams County, Bennett, cities of North Glen, Federal Heights, Brighton, Thornton, and Westminster. $500,000 of that $800,000 will go to rental assistance, and $300,000 will go towards helping those who have no homes. If you need rental assistance or utility assistance or any kind of assistance, again, go to makerhp.org, and Maker spelled MAIKERHP.org. And I just want to add, there's no shame in having to ask for help. There's no shame at all having to ask for help. We are in extraordinary times, and everybody, we need to be helping our neighbors, and we need to be helping other people. So if you are going to bed hungry, or if you are concerned about your mortgage, or you're concerned about your rent or lot payment if you live in a mobile home community, please go for assistance. You can also go to find more information about the other assistance that we have, or if you're a small business or you're a senior or you're concerned about a senior, you can go to adamscountycovid19.org. Thank you. And I don't know who's next. I don't have my agenda.
No worries. We're going to go to Mayor Pro Tem Anita Seitz from Westminster.
Hi, thank you so much for including me on this panel. It is honestly a privilege to get to serve at the same time as all of you amazing elected officials, and your jurisdictions are really lucky to have you. I wanted to really quick start off with a personal story. One of the things I love about this panel is we're all women, and a good chunk of us are parents as well. And it has been a real hustle, trying to balance all of the different things we have to do along with online learning. So I have 3 great kids. I have one daughter who's in 8th grade, a 6th grade son, and then a 3rd grade daughter. And so I also have a very supportive, wonderful husband, but, supporting them throughout preschool on in their educational pursuits had always kind of been my area. And I obviously am an elected official, and then I also have a private sector job. And so really trying to figure out how to be successful on all of these really critical things. I have to do the best job I possibly can for my community. I cannot slack on my kids' education and making sure that I'm giving them emotional support. Especially now, everyone's nervous about making sure they're meeting their needs of their private employers. I can't afford not to have a paycheck. And so balancing all of that, along with all of the traditional duties, cooking multiple meals a day, I had a moment where I actually had to give myself the time out and sit on my front porch because I felt really cranky and overwhelmed and worried that I was not doing everything right. And so I've I've started running in the morning just to help with my own mental health. And the way I rationalized it is I would typically be commuting. And so I don't have to feel guilty about not being there right then for everybody. But that's been incredibly helpful. But I know I'm not alone with that. And actually our city, Westminster just did for our employees balancing work and caregiving training to try to give the employees of Westminster the tools they need, and also kind of the validation that this is a rough time and to assist them. So if others out there are feeling this way, I want to make sure you're not alone. We're all doing our best with Mother's Day being tomorrow. Maybe, and I know there's a lot of dads out there that are feeling the same way, but give yourself a little space and grace, and know that you're doing a good job. So I wanted to take a second to talk about how Westminster has been responding to COVID-19. And our mantra is we need to continue to provide those core services that our residents cannot do without disruption during this period of time. So that's our EMS, our fire, our police, but it's also our water and wastewater. And I think a lot of times people don't realize that those plants don't run themselves. Those are 24-hour-a-day operations. And so it is really critically important that we provide that to people. If you think about the guidelines to help us prevent COVID-19 since the very beginning have been to wash your hands. Think how important water is to this. And so we have been doing everything we can to protect our employees there. So making sure they have the proper equipment, making sure that they have access to testing. We are staggering shifts. Water operators, police officers, these are critical people. We can't afford cross-contamination. So really working on our shift to make sure that they're protected, and that we have certain populations that are never working with each other. So those are some of the things we're doing. We're also monitoring our revenues very closely. City of Westminster, like a lot of local governments, is heavily dependent on sales tax. And so wanting to make sure that we are able to continue to provide all of these essential services in perpetuity is critical. So putting a close eye on those revenues that are coming in and our expenses going out. Luckily, the city does have a new chief financial officer, and he has already proven to be a wonderful investment for the city. With that said, the city is in pretty good shape. Over the last few years while I've been on council, we've actually doubled our reserves. So we are doing pretty well. We do not, in the immediate future, foresee layoffs or furloughs, but we'll continue to monitor that. So we're doing well. We also benefit from having a lot of groceries in our area. So there's no need to panic, but it is something that we're taking seriously. So now, after just kind of those essential core services, our next focus is really trying to promote and protect public health, and then economic vitality of our community. And not just saying economic vitality in the sense of supporting our businesses, which is critically important, but also supporting our residents, making sure that everybody has access to a good quality of life here in the city. And so that obviously means housing stability, access to food, good educational opportunities. And so those are kind of the lenses we have been using for our our CARES dollars, but also our COVID response. So we have done the Westminster Rise program, which is a program for businesses that were affected with the first executive order. So those restaurants, those retailers, salons that had to close down, assisting them with rent through a grant program. So it was up to 50% of their rent. We've spent $914,000. We just opened up a second round so people can apply. Over 80% of those were companies of 10 employees, and 95% of them were less than 20 employees. So these are those true small businesses that really are so vital to the community. We are also participating. We're sending our federal HUD dollars, our home in CDBG, to assist as well. We're going to participate in the Maker program that Commissioner Henry just mentioned, but we're always looking for more ways to assist in that area. So, I mean, those are some of the big things. I did want to, if it's okay, if I've not gone too much over my time, I would like to just talk about how parks, recs, libraries, and open spaces have really proven to be so essential right now to our residents. We have had our base use of our trails has gone up 400% during COVID. And I really believe that this connects not just to people's physical health, but it really connecting to their public health. And I think the value of these assets is really keenly being felt right now. And so I'm so thankful that we do have such world-class open spaces and parks in Westminster. To understand the full impact that families have been feeling, I wanted to share a few numbers with you because they are staggering. We had 2,424 kids that weren't able to attend drop-in childcare at our rec center. And that's just a drop in the bucket. You know, that's just when you're working out. 375 kids that cannot attend spring break camp. 3,832 youth that weren't able to participate in sports. We have 252 programs at the libraries that were canceled. 6,000 kids that missed story hours. 58,000 people were estimated to not be able to attend our libraries during the closure, and that number is based off of average use. So our community has a gap because of COVID-19, and so we are working to really be innovative and figure out how do we fill that gap. Families, they want to have that deeper and richer opportunity for their children, and we have been a cornerstone of that. So how do we reimagine ourselves? To that end, we have really amazing people in our Parks and Rec department that are working tirelessly to bring virtual programming, whether it's aerobics classes or story time. They've been doing a great job. Our electronic book checkouts have gone up 37% compared to last year, and we've actually issued 473 library cards electronically. So we're doing everything we can, but there's some big unknowns out there, and a big one of those, I believe it was Commissioner Pinter raised, is the issue of summer camp. A lot of parents need summer camp in order to work. So it's not even a matter of did they get to keep their job, it's can they do their job as we're going to safer at home. How are they going to leave the kids? And so Westminster feels really that tension, that responsibility of wanting to make sure we protect public health, that we're not becoming a source of outbreaks or anything like that, but recognizing there's a need in the community. And we have not made a decision as of yet. We're still looking at how best to proceed with that, but it is something we're looking because we understand how this impacts our community. And with that, I apologize, I was so long-winded. I would love to turn it over to one of my favorite mayor pro tems, Jenny Wilfred from Northland. So.
Thank you, Mayor Pro Tem Anita Seitz, and thank you so much to Senator Winter, Representative Caraveo, and the many, many extraordinary elected women on this call for the opportunity to join the conversation today. I'm so appreciative. So like many of you, for the last 8 weeks, I've been working from home with my family. So that's my husband and our 4-year-old, who you probably saw his head bouncing around a few minutes ago. And I have to say, it's been a little bit of a roller coaster. I mean, I certainly echo Anita's feelings about just how tricky it is to balance everything, working full time, serving on a council that has a much bigger commitment than ever before, and rightfully so. And on top of that, being a mom. You know, my 4-year-old doesn't care that I'm on a phone call, doesn't care that I'm on a Zoom call. If he has something to tell me, he is going to tell me. And so, you know, we've become pros at Zoom calls with him, whether he's not feeling good or, you know, is taking apart pipe cleaners. We're figuring it out. But in addition to, you know, figuring it out on Zoom calls and everything else, we've been spending a lot of time outside and really leaning into our backyard life. We're really lucky to have a backyard where we can spend some time, and we're doing a lot of gardening, probably not enough weeding. But a few weeks ago, we did adopt, well, I guess adopt or added to a family, 4 chickens. So that's been a bit of an adventure. 2 of them are named Bernadette. I don't know why, it just is. And then we have Ursula, the sea monster, and Chickenbach. So obviously, if you have ideas for what we should name our 4th chicken, I'm all ears. But as we spend more time outside, I've never been more thankful to live next to such incredible neighbors. I mean, they're truly becoming family, and you know, neighbors are what make a community so special. And Northland's a bedroom community, which means that the majority of our residents who live in our city work in another city. So as I'm talking to my neighbors, I've just been really struck by the number of folks that are considered essential, let alone the number of essential workers that are women. So when you think about the cashier, you know, the person who's the cashier, to the emergency room nurse, to the drugstore pharmacist, to the home health aide taking the bus to check in on our older client, to the child care worker taking care of, you know, an essential worker's children. These are the folks on the front lines of our current national emergency, and they are most likely women. The work that they do has been often underpaid and undervalued, and they're an unseen labor force that keeps the country running and, you know, takes care of those the most in need, whether or not there is a pandemic. And I want to add that non-white women are more likely to be doing essential jobs than anyone else. Women make up nearly 9 out of 10 nurses and nursing assistants, most respiratory therapists, a majority of pharmacists, and an overwhelming majority of pharmacy aides and technicians. And more than 2/3 of the workers at grocery store checkouts and fast food counters are women. You know, in normal times, men are a majority of the overall workforce, but this crisis has completely flipped that on its head. And I just really want to take a moment to uplift all of the women out there doing the work as you always have, both paid and unpaid, to keep us safe and keep us moving forward. And I, again, just really want to say thank you. So transitioning into some Northglenn updates, we've had the same closure and restrictions as everybody else. Unfortunately, our outdoor Kiwanis pool will not open this summer, and while we're hoping to be able to open City Hall possibly sometime in June, there still remain a lot of question marks about the recreation center as well as our summer camp program. And so we'll be continuing to monitor, you know, how this virus continues to spread or not spread as we make decisions about when we're reopening. As far as the economic impacts, you know, we know that we'll be facing a budget. Well, we know that we're going to be facing budget challenges as a city, and that our residents will be facing economic impacts as well. And we're working on different plans of action to address different levels of impact. And you know, as we hope for the best, we are definitely committed to planning for the worst. The mayor, the city council, and staff are all committed to making sure that we're careful and conservative as we navigate the pandemic, while continuing to provide a high level of service to our residents. We've already trimmed 15% off of our operations budget and are keeping a close eye on our finances as we move forward. And I want to add that we're not looking at furloughs or layoffs at this time. We're lucky that our city has a 90% reserve, much higher than the 30. Okay, I'll get his arms. Just a minute. Let me finish this here. As I was saying, we're lucky that our city has a 90% reserve, which is much higher than the 3% dictated by the state, and 15% recommended for cities. So, and that's all in thanks to lessons learned from the previous recession, as well as solid forward-thinking decisions of previous councils. We'll talk about it in a minute. Can you let me finish, please? Okay. Anyway, sorry, folks. Real life right here on full display. Anyway, thanks to Adams County, Northland is expecting to receive $3 million in CARES Act funds, and these are federal dollars to support our community as we navigate the impacts of this health crisis. Last week, we launched a one-time Elevate small business grant for qualified businesses with 25 or fewer full-time employees. Grant funds are supposed to be solely for paying up to 50% of 2 months rent or mortgage obligation, not to exceed $6,000, to essentially bridge the gap until other funding sources can be secured, whether through personal loans, federal relief programs, or otherwise. And it is awarded on a first come, first served basis. Aside from the small business grant program, it's really important that our Northland council members hear from residents as to how you think we should be spending the rest of our care dollars. And so to aid you in sharing that feedback, we added a page on our website where you can share your thoughts. And that's www.northland.org /COVID input. And it would be great if you can take a look and tell us what impacts you're facing, what would help you get through this time, what your top priorities are, so that we can take that into consideration and really be sure that we're, doing the most good for the most people and being as strategic as we possibly can for our community. On a different front, I wanted to share just how proud I am of our community that, we've been able to really pull together during this unprecedented event. And I want to share a couple of those things so that we can end here on a high note. So first, the mayor and I started a Northland Cares Facebook group, and the offers from neighbors to help other neighbors, support of donation drives, and just the general positive community spirit that's been demonstrated there just really warms my heart. It's been really special. Our local businesses that are not facing hard times have been very supportive too. We have one tech business that's donated over $25,000 to support our residents in need, our first responders, and our food banks. And we also most recently started a Northland Hug program where residents can request a yard sign for their neighbor that says, "Someone in Northland sent you a hug." They're really cute, and there was such a demand for the signs that we had to order a second batch, which goes to show that social distancing doesn't have to stop us from giving friends and neighbors the love that they deserve. And if you don't live in Northland, we also have a digital version too, so you can also share the love there. So those are some of my brief updates. I'll look forward to our discussion and questions that we'll have after these updates, and I'll pass things over to my dear friend in Thornton, Councilmember Julia Marvin.
Thanks, Jenny. Hi, everybody. I'm Julia Marvin. I'm on the Thornton City Council. I just wanted to thank Senator Winter and Representative Caraveo for having me today, and thank you to everybody for joining us. So a few updates from Thornton on how we're managing COVID-19 and the impacts. We've really been focused on helping and assisting our residents in need, as well as supporting our small businesses to make sure that we all get through this crisis. At our last city council meeting, we approved the distribution of $150,000 to 33 nonprofit organizations that serve Thornton residents in meeting their basic needs, with a focus really on those that are most impacted by the pandemic. So those nonprofits specifically help with food, housing and rental, and utility assistance, and also medical assistance. And we also work to expedite the distribution of the funds so that they get to the nonprofits as soon as possible to help with their much needed work during this time. We also have approved hazard pay for currently for March and April for city personnel who have regular interactions with the public, to thank them for their extra work during this time and also the extra risk that they're having to take on. And then for small businesses, we've allocated $1 million in CARES Act funding for an emergency grant program for those small businesses. So the purpose of this grant program is really to support them if they're struggling because they've had to close or if they've seen a decrease in customers. And that funding can be used for rent, utilities, payroll, insurance, etc. So far, we've approved 83 applications from businesses in all 4 wards with an average amount of about $7,500. We're expecting that we'll probably put more money into that fund in the future. There is a little bit of money left, so if you do know a Thornton business, please encourage them to apply for it. We've had businesses from all sectors: restaurants, nail salons, comic book stores, breweries, dentist office. So really kind of across the board, which is great. We also have more funding coming from the CARES Act through several different sources, which if anyone has any questions, I'm happy to answer it about those. But one of them is we are getting $11 million from Adams County. So shout out to our commissioners for giving that to us. We appreciate it. And that's going to be used for programs assisting, again, the community and our small businesses. So our staff is in the process of developing those programs and what they'll look like. And I'll echo what Jenny said about wanting feedback from citizens. If you have any ideas for how we can really be using this money to be helping our small businesses and our residents and our community, please let me know, because I know that we're definitely looking for input on how these dollars can be best spent. I also would be remiss if I didn't give a shout out to our City of Thornton employees. They have been working really hard the past 2 months to pivot and adjust to the circumstances while making sure that all of our services and infrastructure are running smoothly and that we're taking care of the community. And so I've just been really in awe of all of the hard work that they've put in. And so thanks to them. One of those teams that's been working really hard has been our Community Connections team, and they have made over 2,000 calls to seniors in the community just to check in with them and see how they're doing and if they need anything and how we can help. And our staff is actually going to continue those calls on a weekly basis throughout this whole situation. And then speaking of seniors, we're also going to be delivering 65 donated activity kits to isolated folks next week. And our staff is also utilizing Zoom to provide Silver Sneaker fitness classes, and we'll be looking for more opportunities to provide classes in the future. And then just one thing that we've been doing that's been really amazing to watch is our fire and police departments have been doing birthday drive-bys. And so I've really enjoyed seeing all of the pictures that have been posted on social media, especially the ones where everybody's coming out of their houses to smile and wave, all from 6 feet apart, of course. But one thing that our fire department is going to do on the 16th is in honor of all of the graduates, both college and high school. They're going to do a parade. So they're going to be driving a fire truck along a route throughout Thornton, and you can find out more information about that, including the route, on our city website. What makes Thornton so special, I think, is the community. It's something that we've all said a lot. It's been really amazing to watch everyone step up. And for me, it's really been a bright spot to see everybody coming together. And I think that's something that is really important to look for these days, is the bright spots and the positives and the good news. It's something I'm intentionally doing right now to support my own mental health. I think it's something that's a lot of people on this town hall have said, is that we're all experiencing a lot of worry, isolation, loneliness, anxiety, stress. We're in the middle of a mass trauma, and I think it's important that we recognize that. And while it might look different for each of us individually, we're all experiencing it, and it's hard. It's really hard. So a little bit about my day to day. I don't have any children. It's just my husband and myself and our 2 cats. But my husband is the assistant general manager at a restaurant, and so he has to go in every day. And so we never thought he would be considered an essential employee in a crisis. And so that's been really stressful. It's really scary, like watching him leave every day and worrying about him. And is he going to get coronavirus? Is he going to pass it on to me? Are we going to be okay? And so that's one of the stresses. And then also, city council is not a full-time job. So I'm working a full-time job in addition to doing city council. And so it's been a lot. And, I've broken down a few times and just cried when it all became overwhelming. And I know that that's how a lot of people feel. But what's important, I think, in those times is that you go, and if you're struggling with your mental health, please reach out and get help. It's a treatable illness that many people recover from. You don't have to do it alone. When I had a breakdown a few weeks ago, I called my therapist so we could talk about it, and we walked through it. So if you need it, there's a lot of practical tools that you can use to improve your mental health and increase resiliency, regardless of the situations you're dealing with. Community Reach Center is the community mental health center that serves Adams County, and they're a great place to start. They actually have what's called a warm line, which means that when you call, you'll get connected with directly with a mental health professional, and they're available to talk, listen, and lend support, and also provide referrals to you. So you can call them Monday through Friday, anytime between 8 a.m. and 5 p.m. at 303-280-6602. And then I also, there's a lot of people that are struggling even more. And so if you or someone you know is feeling unsafe or suicidal, please, please, please call the Colorado Crisis Services at 1-844-493-8255, or you can actually text them as well at 38255, and they're available 24/7, 365 days a year, just all the time. So please reach out. And then finally, just remember to practice good self-care. Like Anita was saying, just take the time, give yourself a break, take some time to yourself, and acknowledge that you're doing the best you can in these circumstances, and that things are going to get better. So I think those are all of my main updates, but I'm happy to answer questions later. And I am going to pass it off to Kathy Plomer, Board President of the Adams 12 School Board.
Great, thank you. And this has been so educational. It's great to go last. I got to hear everybody's updates, and I feel Adams 12 is part of 5 different cities. And so it's great to hear what's going on at all different levels. And I just have to give a shout out to the partnership with Adams County, all of our cities, because we really rely on our city and county partners. And I know that Representative Caraveo and Senator Winter are doing everything they can at the state level for schools. So I just want to say thank you. There's a lot of questions out there about what's going on with school. School is something that everyone relies on. We've talked about women in the workforce, and schools need to be open and functioning. And I know you all are working and doing schooling at home. Adams 12 has done its level best to give you all the resources that you need to have your teachers support you in that learning. I'm going to give a quick shout out. We just finished Teacher Appreciation Week, and I think we can all safely recognize teachers in that hero group as they're really working to both educate kids and also just keep that social connection going, because we know it's so critical for kids, and you all are dealing at home with those kids that are missing their peers. That was brought up. Personally, this was supposed to be my first year as an empty nester, and I was crying about that. I wasn't excited about that, but guess what? My kids are home because college is closed. So I have 2 kids that are back, and that is not really where they want to be. I mean, they're doing great, but they were happy to be independent. One was a freshman at CSU. The other's a senior at DU. So she's experiencing that loss from your senior year of what you were excited about, and knowing that you're not going to see certain people because they're all graduating. So that's been really hard. And then my oldest lives in Chicago, and she just was laid off of her restaurant job. So she is there, and she's in graduate school and trying to figure out how she'll keep paying rent in a fairly expensive city. But we're really pulling together as a family. I probably talk to her more now than we ever used to. So, we're just trying to keep those family connections and keep going that way. So that's been good. So let me just share some real quick things about what we're doing in Adams 12. In addition to education, we are really making sure that our students and families don't go hungry. We have a meal service provision 3 days a week at all of our comprehensive high schools. We serve about 50,000 free meals per week. We do make sure that families have enough for the weekend. We've been partnering with Food for Hope, Brimfield Fish, lots of community partnerships to make sure that our families can come and get breakfast and lunch, and then over the weekends have some more food. We also have been trying to serve families that can't make it in for those services. So for about 400 families, our Whole Child Initiatives group has been reaching out to them and taking food, personal hygiene supplies, those kinds of things. And now, starting next week, we are going to have 2 bus routes that help with that. So we're trying to, again, reach those families that aren't able to come and pick things up. I know our Whole Child Initiatives group is also working with families who call the McKinney-Vento program for homeless families. We're going to see more housing insecure families, more food insecure families. And so we have staff at school that is set to help those families, and it is a trusted source. So it's, I feel like, schools are just an essential part of the community, and we're trying to fulfill those functions and connect them to the services that you all are providing at the city, county, and state level, but we're kind of that clearinghouse sometimes. As far as remote learning, we've distributed about 12,000 devices and continue to try and distribute those. There are certain families that we're having trouble reaching, so we're calling, we're emailing, we're trying to make sure that every child has a device. We're helping people with hotspots, and we have some vouchers that'll come from the Comcast program. We have a special hotline set up to assist families with connectivity and technical issues as they try and navigate remote learning. It was mentioned early, the asynchronous piece. That was very well planned, because we know what's happening at homes varies across our district. We have some families that have a device for every person in their family, and they can get on at any time and have lots of help. We know that some houses there's one, and maybe you're going to have to share, and maybe you don't have great internet. We have families that don't have great connectivity, even though we're in the metro area. So we try to make a system where kids could interact with the material when they can do it. And then we see a lot of our teachers who are also trying to have those online connections. And I will just say, I'm really proud of our teachers. You have folks that their only way of teaching was in front of kids, and they switched in 2 weeks. And so they've been doing amazing work, as have the rest of our employees who have stepped up to help with the food distribution and all those other types of things. I'll touch a little bit on summer plans, because I know that's a hot topic. We have been working really hard to figure out how to open up our base programs this summer. And all signs are pointing very positively. We've checked with families. There's a high amount of interest, even though it's not going to look the same, right? We're not going to be able to do field trips to the pool or to the zoo. It'll have to be very focused on what's safe, probably smaller numbers of kids. And then we had to find staff. to make sure that we had staffing for what's going to look very different. And we do have staff interest. I unfortunately don't have dates or times, but please know we are working really, really hard. We do recognize the importance of childcare and know that our schools have been a major way that people get their children having fun and taken care of in the summer. So we're working really hard on that. We're also really working hard on what next fall could look like. And I don't have a crystal ball to know what the public health guidelines are going to be. That's going to be probably the largest determinant of what happens, but also people's feeling of personal safety. We have heard from families that they may not feel comfortable sending their kids. So there are 4 different scenarios, and I'm sure there are many more being considered. First one is really just the traditional in-person learning, that if we get the go-ahead, we'll just welcome kids with open arms. We're all missing having the kids in class, and I know they're missing being there, but again, it'll be with public health guidelines. Then there's another option they're looking at with a traditional in-person learning, but then a remote option. So again, we could offer in-person learning, but if some families are not ready, we would like to give them an option that they could choose remote. They're also looking at a combination of in-person and remote learning. Maybe you have staggered schedule where you send your child 3 days a week and they learn at home 2 days a week, because we've got to make sure that we have room in each building for all the kids. If we have to social distance, that might be a way to do it. And then the last option they're preparing for is just having to do remote. And but please know our number one option that we want is our kids back in front of us with our teachers and support systems in place that they can come to an in-person setting. But we're just waiting. We work really very closely with both Tri-County Health Department and Broomfield Health Department to make our plans. The last thing I'll talk about, and this is the hardest thing, because as the state goes, so do we. We are really, really fearful about the forecast that's coming out next week. Adams 12 has 63% of its revenue comes from the state. We have been told, originally it was, plan from maybe flat funding to 10% of a budget cut across the board for a district. Now we've been told maybe close to 15%. This would be a $42 million cut. And it's absolutely devastating to think about. And, I know that our whole state's suffering. The unfortunate thing is based on our tax structure. We have not been able to recover the last 12 years. So where in 2008, we had to make severe cuts too. We're starting $571 million below what we had then because of the negative factor. So we are cutting a weakened system. We passed a mill last year because our community said they believed in what we were doing and they wanted more for their kids. And so it is, I will tell you, this keeps me up at night because we don't believe anything we're doing is unessential. I mean, our heart is meeting kids' needs all across the board. I will just say right now, we are waiting. We have made no decisions. We have not had we've not talked about specific scenarios. We're trying to leverage what we get from CARES. We're trying to see what we can piece together with one-time money because we want to keep the cuts away from our classrooms as much as possible and our staff. 91% of our budget is salary and benefits. So there's not a lot of room, and we believe, and we just gave our teachers a raise because they deserve it. So we're really, really struggling to figure out how to do this in a way that doesn't hurt our students. And again, we know it's the current reality, but we are also hoping that we can figure something out and make sure that our kids are okay. 271, Initiative 271, if people haven't learned about that, is a source of hope for us, and we're going to probably get behind that with big, very big efforts, just because that's a revenue generating option, and hoping that we can, again, keep our kids learning and safe and happy, because they need us. So thanks.
Thank you so much, everyone. And I just want to thank Kathy for bringing up the budget situation that we're in. So a quick update on a lot of the CARES Act funding. The majority of the CARES Act funding, one, it only went to communities of 500,000 or more, which means our rural communities are really hurting and they need some help. But additionally, a lot of the funding that we got from the federal government cannot be used for backfill. And so when we're talking about making decisions about our school funding, no one wants to cut our schools. And Colorado's looking at a $3 billion plus shortfall from tax revenue with our economy. And when we can't use the CARES funding for that backfill, that means we have to cut K-12. And that's not where everyone wants to be. It means we have to cut Medicare and Medicaid. This week, one of our budget analysts, who are usually very mathematically minded and smart and talk about numbers, broke down in tears talking about the cuts we have to make. And so to everyone on this town hall, I want to ask you to actually ask our federal delegation, including Senator Garner, Senator Bennett, that the next edition of relief money can be used for backfill. Currently, Mitch McConnell said he thinks states should go bankrupt instead of having money for backfill. And that's not right, because we've been having states, unlike the federal government, have to have a balanced budget. Local governments that are on this call have to have a balanced budget. So do school districts. And so because we have to have a balanced budget when we can't use relief funding for backfill, that's going to hurt all of us. This is the most urgent need, in my opinion, in the country right now, is to make sure that relief money can be used for backfill. And if everyone on this call can make that call to our delegation, to have more state and local funding and loosen the restrictions so it can be used for backfill, that's going to save teachers' jobs. It's going to save Medicare and Medicaid. It's going to save state jobs. It's going to make sure that CDOT can still plow your roads, and that's really important. And with that, don't forget about the question and answer section. We're going to go through a couple of question and answers right now, and we also had some question and answers submitted to us before as well. And so the first one that I know, I think both our counties and cities probably want to answer, so I'll just let you choose who wants to answer it, is we've all said you should be wearing masks. It's highly recommended that we wear masks. We know that Denver has required mask wearing. So what are our cities and counties and Adams County thinking about masks? How do we get more people to wear masks? Because we know if we all wear masks, we can open up our economy faster and also protect people. Who wants to take that question?
I'll take it. One of the things that I have on my plate is the responsibility from the Board of County Commissioners as a liaison to the Tri-County Health Department. This was recently brought up by the Board of Health, which is an appointment of mostly medical professionals, but some have local government and funding experience as finance experience as well at the state level. And that Board of Health took it up and made the commitment to have mask wearing be a recommendation. That being said, we are fully in support of every business who makes a choice that's right for their business, and every individual, it is best practices to be wearing masks. There are a lot of different ways to build a mask. An old t-shirt works, a bandana, I mentioned that earlier. The Colorado Mask Project.com, is it .com or .org? It's
I don't know, but Colorado Mask Project, if you Google it, it'll come up.
It'll totally come up. And for our county buildings, when we're able to open at the end of May, starting the first week of June, assuming we're all good with our safer at home process, we will be requiring masks to enter our building. If you do not have a mask to enter the county building, we will provide one to you. And we will also be doing a temperature screen. And you will see other cities and other businesses making similar choices. And we support you in doing that, and it's what you are able to do to support your neighbors. It is not something you do just when you're sick. It's something you do to protect your neighbors from anything you might have. One of the things that's really insidious about coronavirus is that you can spread it while you don't have any symptoms. Especially the younger you are and the more healthy you are, you could run the whole coronavirus cycle and not pop that high fever or have some of the more serious symptoms that somebody who just isn't as lucky or who is a little bit older. So you're wearing a mask to be a good neighbor. And if you go into a business and it has one of those signs that says no shirt, no shoes, no mask, no service, be respectful, be a good neighbor. Use that old t-shirt or a bandana, or have a fancy decorative mask from one of the local providers to make sure that you are able to inspire that consumer confidence so we can all get back out there and start using that economy as fast as possible.
Excellent. Thank you, Emma. And then we had 3 questions related to the Uplands development. I know one question specifically asked for both Anita and I to comment on it. And I will just say that development is completely a local control decision, and that I can't comment specifically on that development given its traffic patterns and density. Although I do say from the state perspective, when we're talking about growth, we all know that Colorado, before coronavirus, had a good economy. We were growing, and that meant when we were talking about growth, we had to make sure that our infrastructure was keeping up in terms of transit, but also in terms of providing affordable housing, making sure we are developing in a way that addressed climate change, making sure we are addressing development in a way that had access to public transit. And so growth is a big issue that we care very much about. And when we talk about a lot of the things we care about, like affordable housing, climate change, growth is part of those conversations. But I'm going to let Mayor Pro Tem Anita Seitz talk specifically about her update on the Uplands development.
Hi, and thank you so much for the questions. And so for everyone that's on the Zoom right now, I just want to give context. So some people call this Uplands, that's the name the developer has given it. Some people call it the farm. Some people call it Pillar of Fire or the Castle. But this is the property that is adjacent to the old Westminster College, our namesake. So this is incredibly beautiful farmland right now. For the most part, there are some parcels that actually are divided up and broken away. But for the most part, gorgeous. I drive by it on my way to work when we were commuting every single day, twice a day. So I recognize that this is a place that people are passionate about and love in their community. So I have to be somewhat careful here because if it comes to the next phase, it will come before me and I will be acting in what's called a quasi-judicial manner. So what that means is I have to stay open-minded and really judge it based off of the criteria that will be presented to us. One of the questions was, do we weigh what is the role of the citizen? How much weight do we give citizen comments? And there's a reason that land use is a local issue, that it's not just I bought a piece of property, I can build whatever I want on it. And it's because the impact to the community is part of that criteria that we look at. And so that will be something that we definitely are weighing. And in fact, in a different issue, there was a land use case that was going to go before our planning commission. And we didn't feel comfortable that we had figured out the right type of community participation with COVID-19. So we actually slowed it down until our clerk and our city attorney could come up with some better options for people to participate in those conversations. So yes, public input's critical. To me, it's always important that government equally enforces our laws. And so we are bound by the criteria that we're given to evaluate. And so I know recently we did have the comp plan adjustment to us, and that did pass because it did meet the criteria based off of that. The next phase, which is the PDP, is a lot of planning language here, but that is where we get a more in-depth analysis about impacts to the city, and that's where those concerns will be more relevant. So definitely make sure that you participate in those hearings if you have strong feelings about this piece of property. You can do that multiple ways. You can email and be part of the public record. You can, if we're still social distancing, you can call in. But at this time, I do not believe it has been scheduled or is even coming forward. And I am removed from those conversations, obviously, because I have to judge it as it comes before us. I can let you know that I always try to take my role when it's quasi-judicial very seriously and weigh the criteria, weigh the impacts. And I do not want to have development come that does not pay its own way. I don't want residents to subsidize the cost of development or have undue burdens. So that's all I can say. So hope that helps.
Thank you. And now we're going to go to our next question. And I'm going to have each level of government answer this, but quickly. So I know we've been in triage mode, but what are cities, counties, and the state thinking about what needs to happen more long-term to boost our resilience? Whether that's revenue, diversification, closing the digital divide, transit, etc. And so I'm going to ask each panelist to answer that in a minute to give an example of all the things we're working on, because I know we're all thinking about it. And so I know that when I'm thinking about resilience, I'm thinking about how we could have had an economy that supports our frontline workers and low-income workers the best. And that means paid family leave, which I'm strongly supporting on the budget in November. We're working on paid sick days. We're increasing our unemployment insurance. Also worked really hard on getting public transit funding as part of the relief package so that our public transit infrastructure doesn't die, along with their reduced ridership right now. So those are three things that I've been doing to be resilient. And then I'll pass it off to Representative Caraveo, and then just let's go down the line and talk about how we're all working to be resilient.
Thank you, Senator Winter. Totally agree with the issues that you talked about. We're also thinking about housing. How can we best prepare for and respond to these crises, and just the issue of housing in the future, whether it's looking at late fees, looking at what eviction policies are, so those don't have to be done as an emergency in the future. And then, as was mentioned before very briefly, Colorado has a very unique tax structure that does not make us resilient enough to bounce back from these drops in our economy. And this is going to take a long time to get over. And so we definitely need to be thinking about that in the future.
Great. Commissioner Pinter, resiliency.
Well, I honestly think resiliency is a lot of factors. And one of the things that's challenging about some of the federal relief that's come down is that it's been used up by large corporations instead of being able to come to the people that need it, the smaller businesses. One of the things that I'm proud of with the work that we're trying to do with Adams County is we have been able to increase our food assistance. Really, truly, I know Commissioner Henry already mentioned this. If you need help, let us know. There is a lot of generosity going on between neighbors, and come in and ask for help. Don't be hungry. Don't let your kids be hungry. We've also done rental assistance, small business assistance for businesses, not a federal definition of small business of 500 employees, but truly small, that are the heart of our community of 25 employees or less. Our cities have matched us in that. And I think that's what resiliency means, is that we're actually looking out for our neighbors, and we're doing all that is we can to make sure that everyone, not just people who are like you and have your lived experience, but everyone in our community feels safe, and that everyone in our community has the capacity to be able to recover, whether you have a really small business, or you work for somebody who has a small business, or you find yourself out of a job for the first time. We are dedicating time and resources to make sure that everyone feels that they have a measure of hope and that they are part of the new economy as it restructures itself over the next several months.
Excellent. Julia Thornton. Oh, Commissioner Henry, resiliency. Sorry.
Yeah, I'll do it fast. Basically, what's really been great, actually, there's a light behind all this, is the fact that we've all been able to work regionally. That's with our state representatives and our municipalities. We get together on a phone call once a week and have conversations about how we can serve our citizens more effectively. And as we continue to do that, that helps all of us understand where each municipality what state representatives are, and what assistance we can give to each other. Another thing is to diversify where we're getting our revenues from. We can't depend on one industry. We can't depend on one anything. We have to make sure that we have many eggs in our basket as opposed to one. So thank you.
Excellent. We'll go to Thornton with Julia.
Yeah, so, first of all, just echoing what everybody has said, I think one thing that this has really shown is the importance of collaboration, especially from a regional level. I think and from a state level and from a federal level, we are all connected. And so we need to make sure that in the future we have systems that are working for everybody, but also that we're all working together, because a lot of these things are huge things that like a city can't tackle on its own. Thornton's not going to be able to fix all of our economic problems. We're not going to be able to fix all of our housing problems, but with the support of, our neighboring cities, our county, the state, the federal level, if we're all working together, we can create a better community that works for everybody.
All right, I'll send it to Kathy with the school district resiliency.
I think it really comes down to us to, we've got to address our equity gaps and opportunity gaps, because in order for a resilient economy and community, all students need to be able to be workforce ready. They need to have what they need to learn and get the skills they need to contribute. And as schools, we need to make sure that however we're providing the education, whether it ends up being remote or otherwise, that we are providing kids all that they need, and we're making sure that the kids that don't have what they need, that we're doing extra for them. And I think that will benefit this whole society as a whole. So just CTE, all sorts of things. I could go on and on, but that's where I think it's at.
Excellent. Jenny, North Glen, what are you all doing on resiliency?
Well, so in my mind, resiliency, is really about our ability to adapt and stay strong during this crisis. And I think, given that we've tightened our belts, given that we've tightened our belt and our budget, I think without impacting level of service to our community, I think that we're doing everything we can to stay resilient. I really want to uplift and echo what somebody previously said around, just how important it is to continue the regional collaboration. Our city's only 7.5 square miles, and we're small. And so it's, that collaboration is so critical, because, we really need everybody's help around us and everybody to come together and be thoughtful and coordinated if we're going to be able to make any strides forward for our city.
Excellent. Anita, Westminster, what are you all doing for resiliency?
It's a great question, and it's something I've cared about the entire time I've been on council, that is really in sharp focus now. I think if there is going to be a silver lining post-COVID, is that we move from a very me culture, not meaning Westminster, but I just mean nationally, to a we culture. I think we know at this point our success and how resilient, how quickly we can bounce back is going to be dependent on how responsible we are as a community, how much we care for each other's needs and practice all of these preventative measures that we've talked about. And so how do we take that gift and fold that into our policies? And I think that's going to take really active listening. We're going to need to watch, listen, and learn. Where are pain points for our residents, for our businesses, for our community? What are things that, are temporary, and what are things that are really going to be cultural shifts? And we need to be mindful of those. The changes in trends and tastes and needs. I also agree that we need to, I hope it becomes now an ethic that we're always leveraging the opportunity for regional collaboration on projects, because I do think typically the whole is greater than the sum of its parts. And we can do things so much better together for our broader community. And I hope that there's a little bit more compassion for vulnerable populations, because a lot of people who had not seen themselves as a vulnerable population have had the script switched. And so I think many people looking now realize how much better we would be with paid family leave. You know, how vulnerable we all are to housing insecurity. So I think I'm hoping that there is a greater level of empathy that impacts our policies going forward. And I think that a more empathetic and aware community is a more resilient community.
Excellent. We'll do one last question with Commissioner Henry. There's a question about prisons and jails are becoming hotspots for the coronavirus. What are we doing to protect our prisoners? What are we doing for early release? And if you can talk about the steps Adams County has taken to in their prisons.
Well, basically, our county jail is actually controlled over with our sheriff, who is an elected official. So he's the one that does the policies. It's not the commissioners that do the policy. We just do the budget for the jails. But I have talked to our sheriff, and what he is doing is he's actually testing on the inmates as they come in. He also isolates them for 14 days when they come in. He has had 2 cases, which right away went into isolation, went into a medical unit. We actually have a medical unit in the jail that can actually deal with those kind of things. Also, the population has gone down. On an average, the population for our jails is around 2,300. It's actually down to a little over 500. So they've actually done some releases, prisoner releases on the low-level crimes, like shoplifting, things like that, trespassing, believe it or not. They do go to jail for trespassing. So a lot of them have been released. So they've actually brought the population down to less than 500. We do have PPE equipment for our deputies that are also in the jail. We approved a budget amendment to go into that. So that is also what we've got. So that's about all the update on the county jail.
Great, thank you. And I want to thank everyone for joining us. I'm going to hand it off to Representative Caraveo in just a second to wrap us up. But I want to thank all our panelists. We all wanted to share a little bit about what our life has been like during quarantine, because today we've talked about resources. If you are hungry, if you're experiencing domestic violence, if you're experiencing mental health crisis, if you need help with remote schooling, know that this is hard on all of us. It's been hard on all the panelists that are here before you. We're real people with real circumstances, and I want to thank everyone for sharing their experiences, and know that you are not alone and that we are going to get through this together. And every time we do wear a mask or stay home, it is a radical act of kindness, and we want to continue practicing radical acts of kindness. And I'll hand it over to Representative Caraveo to wrap us up.
Well, thank you once again to all the panelists for taking time out of a Saturday afternoon to share what's been going on at the different levels of government, and most importantly to all of you who have participated for taking that same time out to hear about what your local governments are doing, whether it's from the school board to your city level, county level, at the state with the House and the Senate. We're all here to help you, and we're all in this together. We have all shared a number of resources during this town hall, and so please keep in mind that you can, first of all, one that we haven't mentioned, go to the state site, which is covid19.colorado.gov, and that is put on by the governor's office and has a lot of statewide resources. And then, of course, there is the website that we've been plugging the entire town hall. Adams County level has a ton of resources, and so many resources are accessed at that county level. And that's adamscountycovid19.org. There's a longer site that is, I'm hoping can be put in, has been written out for you all to see, which is around utility and mortgage assistance. And then there's the Colorado Mask Project that we mentioned, which is at coloradomaskproject.com. In addition, we will all be putting resources on our individual Facebook accounts. Sorry, my cat's trying to make an appearance, and on our Twitter feeds. And once again, all of you stay safe and healthy out there. Remember, today is the first day of safer at home in Adams County, but that still means that we're out there wearing masks, washing our hands, staying 6 feet apart so that we don't go backwards. I know that as a medical professional and at the public health level, we're all really scared about a second surge. And the more that we do to keep infections down, the less likely that surge will be. So everybody stay safe and healthy out there. And thank you so much for joining us this afternoon.